Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
In today's healthcare world, there are many choices. Choices which hospitals to go to, choices which provider. Today we're going to talk with Paula Miller. She is a nurse practitioner. This is another type of provider in the healthcare world. We have doctors, nurse practitioners, all sorts of healthcare professionals you can go to for your health. Paula, we're glad you joined us at the Heart of Health. And tell me, as we get started, what got you interested in healthcare and taking care of people?
Well, I've always had an interest in healthcare. At the age of 16, I started working in a nursing home and enjoyed it thoroughly. Not a typical job for a 16-year-old in the summer. But after high school, I went into a nursing program in a local university, did the 2-year AS program, and began working in an area hospital. I enjoyed it so much, but knew I wanted to do more. So I went on to get my BSN, which is an additional 2 years of nursing education. After that, I worked for 14 years total in the clinical aspect of nursing in an emergency room, and knew that I just wanted to do more, provide more health care and get more involved in patient care. So I decided to go on for my master's in nurse practitioner, and I went to get a family nurse practitioner at a local university.
Now, explain to me a little bit. I know what nurses do. I work with nurses a lot, and they help take care of people, and I'm sure you worked in different areas of nursing. But what exactly, how does a nurse practitioner differ from a regular nurse?
Well, we all like to say once a nurse, always a nurse. You can't take the nurse. So
you're still a nurse?
Yes, absolutely.
Okay.
We still keep our current nursing license. You know, but that type of practice that's instilled from us from the beginning can't be taken away from us. We still have that extra touch, you know, that extra amount of compassion we like to think that we as nurses provide. You know, but in being a nurse practitioner, we get more involved in the patient care. And what we go for additional schooling in is we learn about further assessment, diagnosis, treatment and prescribing in the care of the patient. We can do a lot of things that a physician can. We are described as mid-level providers or physicians extenders. We like to look at ourselves as an added benefit or a helping role to the physician.
You know, and that's going to be a big issue as we get into healthcare, because right now up to 20% of our gross national product is spent on healthcare. And we're going to have to, as a country, learn to do it more efficiently. And that's why it's so important that our listeners learn about what a nurse practitioner does, what are some problems that they handle, what are things that they don't handle. So we're going to delve into some questions now. Our first question comes from the great state of Nebraska. And this gentleman states that he went to a department store and saw an urgent care center. And he wants to know exactly what these centers are for, and do they take care of serious medical problems. So I guess we should sort of talk about what an urgent care center is, what a retail center is, an emergency room. Let's talk about that a little bit.
Yes, Dr. Marcum, there are 3 categories of this urgent care type practices. The first that you mentioned, the retail care, this has been around since around the year 2000, where we see them in pharmacies, actually in shopping malls.
You know, I saw one in a Walmart the other day.
Right, absolutely. These type of care are good for certain diagnoses, certain types of patients. Patients that have extensive medical problems, long medical lists, it's probably not the best choice for them. But for simple illnesses like a urinary tract infection, conjunctivitis, eye irritation, simple rashes, things like that. It's an excellent choice for them to go there.
Okay.
The second level of care is urgent care. We call these ambulatory care centers. This provides just the next step, the next level of care. There we can do x-rays, we can do more invasive procedures.
Can you do blood work?
Yes, we can do
Okay.
blood work. Some of them, a lot of them are right on site. If we don't provide them or can't get testing right there, we send them off to a lab that we work closely with that'll do them for us and get next day service most of the time.
So ambulatory, I guess, means walking. So an ambulance wouldn't bring your patient, would they?
Would not bring them to us. However, we do sometimes have them take away from us.
Okay. And then who should use an emergency room?
Emergency room then is for your more acute conditions. Now this can be hard for just the
Right.
average layperson to decide. Chest pains, abdominal pains with fever, you know, automobile accidents. Again, the patient that has extensive medical problems, maybe has had a heart attack before, open heart surgery before, and they're having chest pain again, you know, they need to go to the emergency room for those acute conditions.
Now, so in talking about this question, if let's say a person had a serious medical problem and they just want to get seen, and in their town they might not have a hospital that's accessible, they come to the urgent care and you evaluate a serious medical problem. What do you do then to help expedite their care?
Well, given what the complaint is, I mean, we will expedite according to what it is. Say someone comes in with chest pain, we will initiate an EKG, give the aspirin, give them oxygen, sometimes exactly what is done in the emergency room, but when we deem it, you know, more acute, we call the ambulance, communicate with the emergency room, and send them directly there.
So it sounds like one of the advantages of seeing an urgent care mid-level provider is convenience.
Yes.
And a lot of patients just have questions that they need answered. Is this a serious medical condition or not? Now, talk to me about expense. That always comes up in healthcare. Would you say it's more expensive to go to the emergency room or the retail or to an ambulatory center?
Well, the 3 tiers is set up just as that. The retail clinic is going to be your less expensive, but again, they don't provide some of the additional services, but they are the cheaper of the 3. The urgent care is 50% or less than what an emergency room will be. The base price of most urgent cares is the same as what you would, you know, pay at your family practice physician. Most of them with insurance companies will come under an office visit copay.
So let me ask you about this. I had a patient the other day, came to me, and they had a sprained elbow. They actually went to the emergency room. They spent 4 hours in the emergency room. And it happened, they weren't sure whether it was broken or not. They thought they might be broken. They didn't know what to do. The emergency room, bless their hearts, they looked at it, did an x-ray, said nothing was wrong. They put them in a sling, made arrangements to see their primary care doctor the next day. What's the wait time? You know, would it be a 4-hour, 5-hour wait, or can you get them in a little bit quicker than that?
Yeah, well, Dr. Marcum, the patient you just spoke of is the type that we like to get in our type of clinics because we feel like we do get them in and out in a very rapid manner. The wait is always dependent on how many come in at one time. Sometimes we can have 10, upwards 15 patients literally walk in the door at the same time. Then the wait time can be, you know, longer. But we like to think that we can get patients in and out in under an hour.
Wow.
You know, in that particular type of patient, we can do the x-ray, we can read the x-ray. All of our x-rays are sent for overread by an actual, you know, radiologist. But if further care was needed for that patient, they would follow up with their primary care physician, or we could refer them to an orthopedic if it was necessary. So all that can be done in an urgent care setting at half the cost and half the wait. And then in the emergency room, it relieves some of the stress that the emergency room has when they get bogged down by patients that, you know, don't necessarily need to be there.
And this could be a problem because right now there's a shortage, as you know, of primary care, and we have to triage to the right agencies. Now, another question that's come up is when urgent care is out there, it says urgent, ambulatory. Do you do preventive care, and can people follow with nurse practitioners and urgent care clinics, or is this only for emergency type care?
No, absolutely. We do provide preventive care also. Again, it depends on what the patient's specific need is. Some patients prefer to follow a primary care physician because they have sometimes that relationship and that bond. But in the urgent care setting, we can absolutely do the same things that they can do also, following, you know, minor medical conditions like hypertension, cholesterol, diabetes management, thyroid management. We can do all of those type things in that setting also.
Now, sometimes urgent care, you just don't have appointments. How would a person, let's say I go to you and I really like you and I want you to treat my high blood pressure. And if I came back again, you don't have an appointment. How would I get you and not another provider?
Well, that sometimes can be the confusing thing. All of our centers that I work for, they all communicate very well, and you can call and ask, is Paula going to be in the office today? And we usually communicate with our patients when we were going to be at that particular facility on the next, at their next visit. But this is something that people need to be aware of, that when they go to an urgent care setting, they may not see the same provider every time they come. So this would be one of the disadvantages.
Okay. One quick question here before we go to break. It says there are quite a few doctors that supply urgent care in my town. I do not have insurance. Would they see me for preventive health if they don't have insurance?
Yes, yes. I mean, whether they are cash pay, or insurance, we treat all of the patients the same.
And I guess if they didn't have cash or they couldn't supply anything, you would know who to refer them to?
Yes, absolutely.
Well, that's great. We're coming up to a break now, and these are very interesting questions, and I hope our listeners are learning a little bit about urgent care, about what services need to be rendered when and where. And I think one thing that we learned already is that urgent care is mainly about taking care of the needs of patients. And I also learned that, not only do you get a nurse practitioner, someone that's more trained, but you still get a nurse in addition. Now, I was not trained as a nurse, so someone that comes to me is not going to get that nursing experience that you might have. That's very interesting. And also, another thing I thought was interesting is the way you work with the other providers. You educate, you can screen, you can move them to the next step if they need it, or you can reassure them this is nothing serious. You can go back to your family care doctor. We'll be right back on At the Heart of Health.